Welcome to my YouTube channel, Orthodontics by Dr. Kieran Daly. Today we're going to talk about an aspect of corrective jaw surgery, specifically for the correction of either a large lower jaw or an excess projection of the chin. This is often associated with another condition called an underbite, and today we're going to use our patient Faye to explain how we corrected these issues. Faye initially presented to my office when she was about 13 with a significant underbite. At this age, the discrepancy between the position of her top and bottom jaws was at a pointer so significant that we were unable to make any meaningful corrections with orthodontic treatment only. At this point, I explained to Faye's parents that we would need to wait until she had finished growing. Usually in a girl, this will be between 17 and 18 years of age. We saw Faye every 12 months between the ages of 13 and 18. And when Faye was 18 years of age, we arranged for her to see one of the corrective jaw surgeons that we work with, Professor Dylan Murray. Following a detailed examination and planning protocol, we agreed to carry out initially pre-surgical orthodontic treatment. Pre-surgical orthodontic treatment is necessary to position the teeth in the correct positions within both the top and bottom jaw. This is necessary so that the jaws can then be positioned in the correct relationship relative to each other and to the rest of the face. You can see in Faye's photographs that she had significant wear of her upper and lower incisor teeth due to the underbite or edge-to-edge positioning of her incisor teeth. Once Faye's teeth were positioned in the correct place, we then liaised again with our jaw surgeon, Professor Dylan Murray, and we carried out detailed surgical planning. Surgical planning is carried out using advanced 3D technology, including scans of both the top and bottom teeth, as well as a 3D X-ray or CT scan of the whole face. A special surgical planning software is used to allow us to position both the teeth and jaws in the ideal place, and then software allows us to fabricate surgical guides that our surgeon can use during the surgery to allow or to make sure that the jaws and teeth are positioned in exactly the correct position. The before and after profile x-rays are a really good way to visualize the changes that have been made in the positioning of Faye's upper and lower jaw. Faye had an underdevelopment of her upper jaw, both in its vertical position as well as in its horizontal position. During the surgery, Faye's upper jaw was brought both forward and down. This was to give the correct exposure of her upper teeth when she is at rest and when smiling. It also allows to give the correct definition of the soft tissue of the nose and the upper lip. Her lower jaw was centered to correct the asymmetry of her chin point and also to allow putting the teeth together in the correct position so that we can create the correct fit of her teeth or bite, also known as occlusion. After Faye's jaw surgery, she then underwent another 3 to 6 months of routine orthodontic treatment to finalize the positioning of both her teeth and bite. And eventually her braces were removed. Faye underwent some minor composite bonding on the edges of her upper front teeth where they had previously been worn. And now in her final x-rays and photographs, you can see all of the changes that we have made to her overall appearance. The paranasal area is the area just either side of your nose. You can see in the before and after photographs the changes to this area that have occurred as a result of bringing the upper jaw forward. You can also see in Faye's before and after photographs the improvement of in the projection and definition of the nose-lip unit. Faye also underwent what we call a genioplasty, and this was carried out to soften the projection of her chin point. At the end of her treatment, Faye now has the correct exposure of her upper teeth, her upper and lower jaws. We've corrected her facial asymmetry, and in the final photographs you can now see we have a happy patient.